Save the Children in Afghanistan have always worked with communities, and it has always traditionally been about listening to communities and developing our programs and our projects. What's new about this project is trying to build the capacity of communities and empower communities to feel that they are able to take action to actually improve their own health services. So it's really based on the rights of children, and it's really listening to those children's and community voices. And then it's thinking about how we can take those voices and take the messages and issues that are most affecting communities and kind of draw a thread from those communities all the way through the different levels of advocacy which we do as Save the Children. So from provincial level to national level and international level.
Lufanyama district is one of the very most remote areas in Zambia. We have a project running there, a child survival project, and most of the health centers lack manpower, especially skilled manpower. The quality service that is delivered in connection with the maternal and child health services is compromised. There's one rural health center which had no midwives for a very long time. TBAs were the ones who were conducting the deliveries. Community health workers were the ones who were screening and prescribing. This brought a lot of concern among the TBAs and the community. With our support, and they are pushing, the district health office managed to give them at least 2, not 1, but 2 health workers.
What came out of this pre-assessment which we conducted were that the knowledge levels were actually very low in relation to child rights budget, and also maternal health issues programming. So after we did this assessment, we were able to conduct various trainings. For the first time, we saw that the 14 trained elected leaders were able to actually vote for the construction of a maternity wing, which will actually go a long way in accelerating access to maternal health services.
India doesn't have a home for nutrition, and the ICDS scheme, which is the large nutrition scheme from the government of India, is very poorly implemented. So we said we need to work at 2 levels. One, at the local level to make sure that the ICDS is implemented in the way it's meant to be, and at the national level really to work towards a home for nutrition. A large part of our work was also to actually work with health workers and community members to build their skills in communication, because if they're able to advocate with the local government is when they'll get heard. And finally, facilitating meetings with the local functionaries where they could actually table their asks. At the national level, on the other hand, we decided to use a combination of high-level media, advocacy, and public action. The Life Free from Hunger report actually provided us with that opportunity. What we're seeing now is when a year ago the Prime Minister said malnutrition is a shame, today we have the Minister of WCD actually go to the Call for Action, Child Survival Call to Action meeting in Washington. She went to the Hunger Summit, something that the Indian government leader hasn't done for many years. And we had the Prime Minister on the Independence Day this year say that the ICDS is being relaunched in a mission mode with funds and completely costed. So that's really the outcome of the year-long efforts.
In January this year, we identified nutrition as a priority since it was part of the EveryOne campaign, and also because there were ongoing discussions on nutrition within the forum of the World Health Assembly. We knew that there was an action plan on nutrition that was drafted and up for adoption at the World Health Assembly in May, and we knew that that plan would include a global target on stunting. And as Save the Children, we were prioritizing that global target to be adopted. We held a series of side events where we tried to bring in the local to global project, for example, through a parliamentarian from India who came to a side event on nutrition in Geneva at the Human Rights Council, bringing a human element to the issue. We held a side event within the context of the World Health Assembly, and again tried to bring in the local level example by inviting an Afghan representative from the Ministry of Health to speak about the Afghan example. Why is nutrition important? Why do we need a global target on stunting? What effect will that have on us at national level? And so at the end, we've ended up filling up a room of over 100 people to come to the event. The key negotiators were there, the key agencies were there, the key people that were leading and thriving and pushing for this global plan to be adopted In the end, the plan was adopted. We now have a global stunting target, and we are working with the countries to make sure that that's translated to national level targets and ultimately an improvement to the nutrition status of children worldwide.
So we worked with national NGO network ACBAR, which is Afghanistan's biggest NGO network, to develop a series of 4 policy briefings, one of which Save the Children led on service delivery and particularly on health services, calling for donors to make commitments that are long-term, sustainable and predictable for 2014 and beyond to ensure that health services continue for mothers and children. Together with ACBAR, we conducted a series of lobby meetings bilaterally in Afghanistan with all major donors, and we worked with colleagues in donor capitals to ensure that our messages and our lobbying was aligned, so with the EU, with Australia and so on. So the outcomes of the Tokyo conference was that the donor community pledged $16 billion worth of aid across the board. A number of donors also made specific commitments to health, or they mentioned health as one of their priorities. And we also, the National Priority Programme, which was presented by Afghanistan to the conference, included a number of our key messages, such as around nutrition, prioritising nutrition and health workers.
My story is actually about building up on the work that Rachel was doing in Afghanistan and ahead of the Tokyo conference. We have been working on the EU budget and specifically allocations for children's health in the EU budget. And Tokyo conference was one of the key milestones for us as well. I mean, the negotiations in the EU are still very much ongoing. No decisions have been made whatsoever. But I think that one of the key issues for us was that Commissioner Piebalgs actually made a financial commitment towards Afghanistan in the future, and that will be some 200 million annually from the EU. And what did we do? We had bilateral meetings with the EU staff in Brussels, while Rachel was doing her bit of the work in Kabul. The EU is not about key moments, it's about establishing a working relationship, and that we have now. And now the next step will be then how the EU is going to use that 200 million per year. And we already know that health is going to be on the agenda, which is great for us.
The challenges with Local to Global, I think, are how to take community issues and the issues that are most affecting communities and children, and how to make them relevant at all the different levels of advocacy. So how do you take an issue which is affecting an 8-year-old child in northern Afghanistan and make that relevant to an environment at the EU or at the UN office in New York? So that's a challenge and something that we'll have to continue to work with.
Highlighting and putting into action the participation of children in this project. The international bodies are not so comfortable with children in particular speaking in high-level arenas, so we need to look at different models for raising those voices and engaging children in these sorts of processes.
At this point, the Indian government, I would say, is in a position that's pretty secure in the fact that India is a booming economy, and do they really need to listen to anybody else? And therefore, a link with what's happening internationally and international pressure coming back to the Indian government is a big challenge for us. I think the easier piece is really to work with communities or also use that as a device to feed into national mechanisms. That's the easier part. But it's the second and third leg which is really challenging for us.
We do realize that as health workers, of course, they are paid by government, and it's a big challenge for them to present issues to government. But I know that it is a bit easier, like we've done through the elected local councillors, because they have that authority, they have that access, and it's easy for them to actually discuss with the Member of Parliament and the authority that be. The Local to Global is actually cementing everything that we are doing, because there's no work that we are going to do without the issue of advocacy.
We know that advocacy is a long-term engagement, and the outcomes of advocacy initiatives are actually long-term. You cannot see them in a specific period of time.
It's helped us coordinate all our efforts. we were doing stuff with the community at one level, and we were doing national level advocacy. And there was something going on the one side at international, which we used to sort of support in whatever manner we could. The Local to Global project has actually helped us coordinate all our efforts around one single theme, around one single idea, and around one single message. So what we do with communities feeds into the national demands and then feeds into international mechanisms and processes. So that's one thing. It's helped us coordinate all our advocacy efforts. To me, the most important outcome and the benefit of this project is that now we have communities, well after we are gone, well after Save the Children is gone, there are communities that can actually carry on doing this work in a sustainable way. And that's the real benefit of this project.